Good evening, students. Today, I am going to discuss on routes of drug administration. This subject is very important as far as general pharmacology is concerned. As you know that the drugs need to enter into the body at least through one or the other route. It can start from oral route or parenteral route. Oral route or parenteral route. Oral route is also called as enteral route. Parenteral means other than enteral route. Okay. So enteral means gastrointestinal tract. Okay. So this is a very interesting class and it's going to be a series of classes related to routes of drug administration. Because I know that it's very important and it's very difficult to complete in one go. And I don't want to hurry. This class is mainly targeting the MBBS students who recently passed due to supplementary examination, and since they passed in supplementary examination, they lost some of the classes which a regular batch would have already attended. So to compensate their requirement, I'm conducting these additional classes. I request everyone, whoever is attending these classes, I request everyone to share these classes links to all the additional batch students throughout the country. And all these classes are organized and conducted as per the competency-based medical education. So now, as all of us know, that competency-based medical education is conducted as per the standard single learning objectives. In the routes of drug administration class, what are the objectives we are going to achieve? We are going to list the various routes of drug administration, including oral, parenteral, and topical, with examples we are going to do, and then describe the merits and demerits of each route, which I am going to highlight, and then choose the correct route of drug administration in a given clinical scenario. So I will discuss few clinical scenarios and also discuss what are the rationales for choosing that particular route of administration and what are the advantages and disadvantages of such routes. Now let us start with a case study. So in this case study, the case study goes like this. A 45-year-old patient presented to emergency department. Remember, a 45-year-old patient presented to emergency department with symptoms of tonic-clonic seizures. Seizures means epilepsy. Okay, so a 45-year-old patient presented to emergency department with symptoms of tonic-clonic seizures. And now it is your turn. Please suggest the preferred route of administration of drug in this patient. So which kind of route can be selected for this patient? As you know that patient is in tonic-clonic seizure and the patient is presented to emergency department. The patient is in the middle age. Okay, so obviously, since the patient is coming to emergency, means patient must be having emergency situation and maybe unconscious also, and tonic-clonic seizures are going on. Maybe this patient may be a status epilepticus patient also. So in that case, I would say that this patient requires immediate treatment where the drug should enter into the blood circulation immediately. It means that the drug should enter into the body through some routes where it reaches immediately into the circulation. So can we give oral route? I don't think, because oral route is having means tablet. If I take a tablet, it takes a lot of time, maybe 1 hour, half an hour, or maybe more than that to reach the circulation. So in that way, I don't think we can take oral route. Then which is the next route? Can we take any other routes like injections, which is injections are very popular. Injections like subcutaneous injections or intravenous injections or intramuscular injections. So if we see this case, generally a tonic-clonic seizure in status epilepticus, we try to give injection diazepam. Benzodiazepines are given. Diazepam is the preferred drug, 10 mg. You can take a syringe, load 10 mg into the syringe, and then inject slowly intravenously. Okay, so intravenously, if you give diazepam, there is a very good chance that this status epilepticus may get arrested. Or we have other intravenous solutions are also, that is phenytoin or fosphenytoin. They are also available, so you can think of those also. So this is one case. Now let us get into the next case. A 11-year-old boy presented to dermatology department with symptoms of itching and dryness of skin in the extensor area of the elbow joint. He was diagnosed with atopic dermatitis. Please suggest the route of administration of drug here. So you can see here a patient with 11-year-old is a boy presented to dermatology department with symptoms of itching and dryness of skin in the extensor area of the elbow joint. He was diagnosed with atopic dermatitis. So generally we can take local route of administration. So we don't require systemic administration, maybe some antihistaminics for too much of itch. So in such cases we can give. Otherwise, generally local route administration is preferred. Tablet orally we can give some antihistaminics, but otherwise we can go directly for treating with local ointments. Okay, so topical application of ointments are sufficient for treating this condition. So both the conditions are different. So earlier one is a patient who came for emergency department with tonic-clonic seizure. They require immediately IV, and in this case what you are seeing, this is a patient not in the emergency, comfortable with attending the dermatology OPD, and itching and dryness, patient is comfortable, not much of any serious illness. So patient can get oral treatment for itching and local or topical ointments for the dermatitis or dryness of skin. Moisturizing agents can be given. So now we are getting into the topic of routes of drug administration. What is routes of drug administration? So routes of drug administration is the path by which a drug or a chemical substance is given a way to enter into the body. So, drug should enter into the body in one or the other way. So, we have to choose the method through which we can give the drug into the body for its action. Okay, so whatever the routes in the picture, you can see that so many routes are highlighted right from top to bottom. Okay, so intranasal route, then sublingual route, transdermal route, then you can see intramuscular injection, subcutaneous injection, intravenous injections. Then you can give oral drug administration. Then you can get into enema or suppository administration like this. Also, you can apply locally. Local applications can be into the intra-arterial injections like this. I will come back to all these routes very soon. So, route of administration is the path in which a drug or a chemical substance can enter into the body. So now let us try to classify the routes of drug administration. You can see there are three important methods of administration. One is enteral route of drug administration. Next one is parenteral route of administration. Next one is topical route of administration. Enteral route of administration means through GIT, okay, gastrointestinal tract, through gastrointestinal tract from top to bottom at any place. If you are giving the drug, then it is considered as enteral route. So you have oral route, buccal route, sublingual route, dental cones are there, then rectal route. Okay, so like this you can have some routes of administration: oral route, buccal, sublingual, dental cones, and rectal route of administration. Next one is parenteral routes of administration. What are the parenteral route? Other than gastrointestinal tract. Okay, other than gastrointestinal tract, if you consider, they are considered as parenteral routes of administration. Intravenous route, intramuscular route, intradermal route, intra-arterial route, or intracardiac route. Okay, in intra-articular route and intracardiac route. So next one is you have topical route. So you can give administration to that localized part of the body, either on the surface or inside the cavities. So in that way, topical route can be on the skin or inside the cavities. Okay, so like this you have varieties of routes of drug administration. So in the full, if you attend all the series of lectures which I am going to do, then you will learn a lot about routes of drug administration. External routes or enteral routes or oral route, buccal route, sublingual route, dental cones, and rectal. So I think next one is parenteral route. I think there is a spelling mistake, so please correct it. That is enteral route, not external route. It is enteral route. Parenteral route is intravenous route, intramuscular route, intradermal route, intraarticular route, or intra-arterial route, intracardiac route. Then topical is on skin and cavities. Now let us try to just discuss this part of the picture. Okay, so you can see that this picture is containing so much of information for you. So let me just try to explain what is seen here. You can see that routes of drugs can come from top to the bottom. Okay, so you can see here there is a Skin is there here first to start with, so topical applications can be done. Then here you have, accuserts can be given or eye drops can be given. Here you have ears, again intra, or drops, ear drops can be given. Then you have nasal route, so you can have nasal sprays. Then you can have inhalation route to the lungs by giving the meter dose inhalers or rotahaler, all those things you can give. Then you can see that there is oral route is available, and also sublingual route, and also buccal route is here. Okay, so buccal route, sublingual route, and enteral routes, that is oral route of administration you can give. So the drug directly enters into stomach, and from there it gets into varieties of channels that I will discuss. So you can see that generally. So then you have a transdermal patch is available here. So transdermal patch you can see. Then intramuscular injections are there, intravenous injections are there. These are the parenteral routes of administration. In the oral route, once the drug comes into the stomach, then it will get absorbed, and also in the duodenum, small intestine, majority of the drug is absorbed in the small intestine. So then you can see here there is something called as, there is something called as first pass metabolism. So the drug that is entering into gastric this is, I think this is heart, this is gastric contents. Once it is coming into here, so it gets into small intestine, large intestine, and then so here on the way from gastric contents, so it can get absorbed into the portal circulation. From there, so it gets into the liver. Okay, so in the liver what happens? First pass metabolism can happen. And first pass metabolism not only can happen in liver, it will also happen on the mucosa of the GIT, and also like if you are giving inhalation route, there also in the lung also some amount of first pass metabolism or some kind of destruction of the drug can happen. So generally, suppose like if you give acetylcholine or so if you give methacholine and all, so generally once it reaches the small intestine, there itself we have cholinesterases, so they will destroy these drugs. So in that way, less amount of drug enters into the systemic circulation. Similarly, nitroglycerin also. So a lot of drug gets metabolized. So that is about the portal circulation and first pass metabolism. So after that, so you can see down the line you have, so you can give some amount of drug through the rectal route also, that is as suppository, and also as enema you can give. Okay, so I believe that I tried explaining you this picture. So if you carefully see, a lot of information is there in this picture. Hope I'm clear about this. So now let me go to the next. How to select the route of administration? So selection of route of administration depends on the drug characteristics and also patient related characteristics. What are these factors? Okay, so you can see here lot of factors related to drug and patient related factors are discussed here. So safety of the drug. Okay, so if the drug is very safe, then we can give oral route, and patient themselves they can administer themselves, and it is efficacious. If it is having very efficacious highly potent drug, then chances of having the adverse events are very high. So one need to be careful about it and instruct properly, and also route of administration to be decided. Suppose if it is orally efficacious, then it can be administered, even in emergency through oral route also. If it is very, safe but less efficacious orally, then it need to be given through the intravenous route or any other alternate route. Or if the metabolism is very high and it is not entering into the systemic circulation after giving orally, then we have to go for alternative route. And also patient preference. Majority, so if you go to rural areas and all, generally the patients comes to you for taking injections only. Okay, so if the patient prefers to take injection, then it's a little bit tricky thing whether to give injections or not, because injections are having their own problems. And so why to give injections unnecessarily, that is something to be debated later, so that I'm going to do it later. But patient preference, so should we listen to them all time or not? So that is also something what we need to debate. So that we will do it later. So most importantly, if the patient prefers to take orally, then most of the patients, especially if we accept rural some patients, otherwise majority of the patients interested to take only oral drugs. Okay, so that is also one of the thing which we can think of. So in such cases, generally oral drugs to be given. And also, what is the economy? Okay, so if the so generally oral drugs are very economical. Okay, so economical route of administration, and in that way tablets will be very cheaper. But when we compare the same drug with the injections will be much more costlier and also requires an expertise, like doctors or technicians or some kind of nurses, or so laboratory assistants are required. So for giving drugs, injections or intravenously, definitely nursing staff is required and a doctor is required if at all you need to give injection. Therefore, one need to be careful whether to increase the cost of medication or not. So suppose in diabetes, you can see that India is the diabetic capital, diabetic capitals. In that case, we have millions of patients who are suffering from diabetes, but they would like to take oral insulin. But unfortunately, we cannot give oral insulin because it's a protein, it's a peptide which gets metabolized in the stomach. So because of that reason, we are not able to give insulin through oral route. We have to give through injection. Okay, subcutaneous injections to be given. So like this, if we see here, what are the other factors which are going to influence the route of administration, choice of route? That is patient characteristics like BMI, age group, or gender, medical status, renal impairment, comorbidities, personal attitude towards the safety and convenience, past experience. If the patient is happy with oral route, you can give oral, or if they are interested only in the injections, then that is a tricky case one need to think of. And perception of current disease status, health literacy, socio-economical status, medications administered related to injection site. Suppose injection site is good, and then you can give, suppose if it is infected or not suitable, then you have to think of some other route. Then how much dose is required, frequency of administration. See, oral route is very convenient for long administration, repeated administration, but if you have to give injections repeatedly, then it's a one need to think of. Then formulation characteristics, then administration time, indication, flexibility in the route of administration, healthcare staff, institution related knowledge, and human resource availability. So like this, like varieties of factors are there which we are going to discuss in detail when we are talking about each and every route of administration. Okay, so at that time I'll be giving some highlights about how these are going to affect the choice of the per route of administration. So this is just to give you some overview that drug related and patient related factors are important in selection of route of administration. If the drug is stable in tablet, then we can give tablet. If the drug is not stable in tablet, then it has to be given in injection format. So like this, like varieties of drug related factors can be considered, and also patient related characteristics can be considered. So the factors that govern the choice of route is physical and chemical care properties of the drug, then emergency or routine use. If it is an emergency, then we prefer to give injections. If it is a routine case, then we prefer to give oral route. So physical and chemical characteristics of the drug, I can tell you that if the physical drug is not stable in room temperature, then better to make drug in the solutions and give as and when, especially in that case you have to reconstitute as and when required and then give. If the drug is very sensitive to sunlight, then it need to be given in a separate manner. So that is also like, if it is a solutions, then you can give injections. If it is a syrup, then it need to be given orally. So like this, site of desired action, whether it is local action or systemic action. So if the, like as I said, skin case, we discussed itching and dermatitis case, atopic dermatitis case. In that case, local route is enough. Suppose if it is an emergency, or if it is diabetes, hypertension, systemic organs to be modified, their functions need to be modified. At that time, then systemic drug administration is important. One need to consider rate and extent of absorption of the drug. Okay, so if the drug is well absorbed orally, viability is 100% or good viability is there, then we can go for oral route of administration. Suppose if the drug is not at all absorbed, like what I just mentioned, insulin or nitroglycerin or any other drugs, like some drugs which are not absorbed orally, in such cases, then better to give in the alternate route of administration. Then the patient condition. If the patient is conscious, then give orally. Unconscious, then it is impossible to give oral tablets or capsules. Better to use the alternate route of administration. Then vomiting. Okay, if the patient is having vomiting, then first give the antiemetic and then think of giving oral route if at all patient is able to tolerate. Otherwise, then you have to, for giving antiemetic, then you may have to go for first initially give the injection and then make the patient comfortable, then you can give oral. Then diarrhea, patient is again having too much of diarrhea, dehydrated. In such cases, better to give quick rehydration is required, so go for intravenous administration. Then age of the patient. Okay, if the age of the patient is like a very young age or very old age, who are not able to like swallow, or some cancer patients are there, they're not able to swallow the tablets because of some esophageal cancer and all. So then you have to choose the alternate route, or you may have to put nasogastric tube and then give through that. So solids may not be given, you have to give only liquids. So if it is if a patient is a child, then again you have to go for a proper route of selection. Either syrups can be given if the patient can swallow, or otherwise you have to give suppository. So involuntary routes. Okay, so suppositories can be given, or you can give any injections can be given. Then effect of gastric pH, as I just already mentioned, gastric pH, digestive juices, so or first fast metabolism. So gastric juices, they are very, gastric pH is very low, so acidic environment and alkaline drugs are not properly absorbed there. So if you want the drug to act in the GIT or any other like gastric contents, if it is not able to get activated in gastric mucosa, then it's difficult. So you have to administer in the appropriate route. Otherwise, if the gastric pH is very low, then proteins, if you give the proteins into for absorption, they will get denatured there itself and they will get destroyed. So they will not be able to get absorbed. Similarly, digestive juices can digest so many food particles including drugs also, and presence of one drug can alter the absorption of other drug, or they can make salts, insoluble salts, and the drug may not get absorbed. Or first pass metabolism is something, like what I'm saying is here, once the drug is given and it enters into stomach, there, like it pass through the, GIT, that is duodenum and small intestine. There it gets absorbed and it gets into the portal vein. It goes to liver. In the liver, the drug will start getting metabolized. And even in the small intestine mucosa also, there also drug can get metabolized. This is called as first pass metabolism. Whenever at the site of absorption or in the systemically, that is in the liver, the drug gets metabolized. Especially this happens when you give the drug orally. So once the oral drug is given, it goes into stomach and duodenum. There it gets absorbed and first, portal veins. Through the portal vein, drug reaches to liver, and there it's as you know, liver is having so many enzymes, and it will these enzymes will cut the drug and make into pieces, and then finally only little amount of drug will enter this circulation. This is called as first pass metabolism. We'll discuss about this later. Then accuracy of the dose required. Suppose, like very minute adjustments are required, then better to go for intravenous administration or sublingual administration or any other, other routes. So in that way, so you can think of, like very accurately dose is to be calculated or to be given in emergency, to be given. So in those cases, you can think of giving in the appropriate route. Okay. Then patients and doctor's choice, which I already discussed. Some patients want injections. They go, especially in the rural areas, and you cannot avoid. You will have to give, and also you can supplement with the oral route also. And if the doctor think that, like for the better of the patient, it's better to give so in a particular route, then you can think of giving in that particular route. So now I will, at this stage, I think I would like to stop here. Then we will again continue our discussion in the next class. Okay. So types of topical routes, systemic routes, and other routes, parental routes, and all those things we will discuss in the next class. So thank you very much. Please do visit and share my discussions with the students who may get the benefit of these classes. Okay, so please inform all the students who are interested to attend these classes, and help us to reach out to the right kind of students so that they can benefit out of my efforts. Thank you. I will continue the routes of administration in the next class.